Good morning and welcome to Radio Friends on Wednesday, July the 18th. I got a very special person here today. He just happens to be my doctor, Dr. Kyle Fiala from MU Healthcare Orthopedics Institute. Good to have you here,
Yeah, thanks
Dr.
for having
Kyle.
me. Yep.
You are with the Missouri Orthopedics Institute, and you do all kinds of work to take pain away from people in their ankles and their foot, right?
That's correct. Yep.
Yeah. Now, you happened to fuse my ankle about not even a year ago. It was 6 months ago. I was in a great deal of pain, and we talked about this for over a year, saying that was the last resort of going to it. And I was nervous, but it all came out just fine, and I'm walking around pain-free now, which is, it almost seems like a miracle.
Yeah, it's been amazing.
The work that you do, was this possible even 5 or 10 years ago?
Yeah, the procedures that we've done, or we did on you, they've been around for quite some time. Well over 50 years or so.
Really?
Yeah.
Oh, I thought this was a brand new procedure.
Oh no.
So what are some of the procedures that you specialize in?
So our practice at the Missouri Orthopedic Institute, there's myself, and then there's two other physicians, Dr. Summerhays and Dr. Schweizer. We primarily just kind of specialize in any kind of foot and ankle pathology. So that can be bunions, hammer toes, foot deformities, flat foot, high arch foot, and a lot of kind of post-traumatic issues, post-traumatic arthritis of the ankle, the foot, things like that. We do see quite a bit of infections. Some of our diabetic patients get wounds and sores, infections, and things like that.
So what kind of results do you have when you start with a patient?
We always want to make sure that we've tried everything non-surgical that we
Right,
can.
and that's exactly what you did with me. When I came into you about 2 years ago, I was having a really hard time, and you said, you know what, surgery is the last resort. And we tried everything, and it got better for a while, even did the shots.
Mm-hmm.
And then it was so bad, I remember I was in Hawaii, and I emailed you and said, this is it. I can't handle it anymore. And that's when we decided on that surgery.
Yeah. So we always want to try to make sure we can do everything we can short of surgery. But when we ultimately decide that surgery's, that's the road we're going to go down, we usually talk. We kind of have a heart-to-heart and say, hey, these are kind of our options, A, B, C, D.
Right.
And this is kind of what we're going to do. This is what we should expect. And so, as you know, it's not necessarily an overnight success. That surgery is kind of just one part of that puzzle, or part of the process. That it's really several weeks, several months down the line that we ultimately see the results.
You told me, you said I should expect a year's worth of recovery. And I got to tell you, knock on wood, it's been 6 months and it's pretty close to normal right now. It's much better than what I thought it was going to be.
Yeah, well, you've made the comment before. You're a really good healer, and that this is true.
And I think having a positive attitude and willing yourself to try to heal that makes a difference too.
Yeah, and for you and for a lot of our patients, you're very healthy, you're very active, you have a really good support system, and so all of that plays into the recovery.
Are you ever too old to have something like this done?
Yes and no. I mean, I think age, is a little bit just of a number. So you can be a little bit older, but still be very, very healthy, very active, and still be a good candidate for surgery. So there's a lot of factors that come into play.
Yeah. Well, I thank you for what you did for me. And a lot of other people, I'm sure, are appreciative. If they want more information about the Orthopedic Institute, what's the best way to go about it?
They can go to our website, which is muhealthcare.org, or they can call our personal office number, which is 573-882-6708.
Okay, and they can ask for Dr. Kyle Fiala.
Yep.
Okay. Kyle, thank you so much for coming by. It's a pleasure having you here, and thanks for taking my pain away.
Perfect. You're welcome.
Appreciate it. Again, if you want more information, you can go to the web. It's muhealthcare.org, and they'll take good care of you.